Thank you. Anyone else in opposition? Please state your name and your position. Thank you.
Janelle Trevathan from Pleasant Grove, California, and on the board of directors of A Woman's Friend, in opposition.
Marie Leatherby, Executive Director of the Sacramento Life Center, in opposition to the bill.
Patricia Del Marmo, I'm the Northern California Area Director for Concerned Women for America, in opposition.
Alex M. Ingalls, Elsinore Valley Pregnancy Resource Center. I stand in strong opposition.
Sandra Ingalls, Wildemar, California, opposition.
Olga Herman, Reverend Olga Herman with JC Resource Center, representing many people for life, in a strong opposition.
Michelle Gonzalez, registered diagnostic medical sonographer, in opposition.
Lynn Fuller, Executive Assistant, Sacramento Life Center, in opposition.
Stephen Olarts, Patient Advocate at Sacramento Life Center, in opposition.
Jeannie McLeod, the President of the Board of Directors of the Pregnancy Help Center, in opposition.
Adrienne Gross, Executive Director of the Pregnancy Help Center in Torrance, in opposition.
Helen Ivakov, representing Alternatives Pregnancy Center, in opposition.
Julia Brosserhaus, registered nurse at Alternatives Pregnancy Center, urging opposition.
Lori Love, Wildemar, California, strong opposition.
Scott Love, Wildemar, California, strong opposition.
Dr. Sterner Sosa, OBGYN, in opposition.
Angela Bennett, President and CEO of SCV Pregnancy Center, strong opposition.
Travis Dodds, concerned citizen of California, I urge you to vote no.
Nancy Hansen, Executive Director of the Center for Life Choices, and I respectfully ask you to vote no.
Winona Hayes, volunteer at the Center for Life Choices in Ukiah, and I urge opposition.
Conrad Annual, I'm the president of the Elsinore Valley Pregnancy Resource Center, registered as a charitable corporation in California. We strongly oppose this measure.
Susan Money, Director of 40 Days for Life, and I beg you to vote no on this measure.
Wynette Sills, Director of Californians for Life, in strong opposition to this bill.
Mary Sari, strong opposition to this bill.
I'm Ralph Merletti, a member of St. Rose Parish, South Sacramento, and I strongly oppose this very unfair bill.
Tanya Flores, a volunteer at Alternatives Pregnancy Center, providing after-abortion care. I oppose this bill.
Tricia Lewis, Director, New Life Pregnancy Center, strong opposition.
Leslie Foss, Butte County, 40 Days for Life, Women's Resource Clinic, abortion survivor. Keep your oath of office. Vote no.
Annabelle Ward, supporter of A Woman's Friend, please vote no.
Don Mecha, board member, Pregnancy Help Center, Torrance, California, fully licensed medical facility. Please vote no to this abomination.
Sandra Palacios with the California Catholic Conference. We urge your no vote on this bill.
My name is Chastity Ronan. I am a San Francisco resident and the Executive Director of Alpha Pregnancy Center in San Francisco. I urge you to vote no.
Hi, my name is Janet Niemeyer. I'm the Executive Director of Caring for Women in Oroville, California, and I appeal to you to please vote no.
Aubrey Billack, Director of Client Services and Caring for Women, Oroville, California. I oppose this bill.
Jonathan Keller with the California Family Council and California Family Alliance, respectfully requesting a no vote.
Steve Patton, a constituent of Dr. Pan and also representing Bishop Soto from the Diocese of Sacramento, asking for your no vote.
Paula Leary, Executive Director, Lodi, California, please vote no.
God is watching. Democrats For once, don't toady to the Planned Parenthood abortionists and baby killers. Show a little independence and courage. God is watching.
Thank you very much. Seeing no other opposition, I believe Senator Nielsen had a question or a comment.
Well, a couple here, if I may, Mr. Chairman. In the Section 1, it says the most effective way to ensure quickly obtain information services need to implement timely reproductive decisions, and that they are immediately, to implement timely reproductive decisions is to require licensed healthcare facilities that are unable to immediately enroll patients in family pact and they number presumptive eligibility for pregnant women. But it goes on to say in various publicly funded family planning and pregnancy-related resources are available in California in the manner in which it's to directly and efficiently access those resources. What evidence supports that contention that any other kinds of clinics are not capable?
Let me first start with a response, and then I'd probably like to turn it over to one of our sponsors on this. And first of all, let me also want to thank everyone who's come out today. I know that this is a topic of which there are many deeply held beliefs, but I want to thank everyone for their sincerity and their passion of their perspective on this. Part of what is at issue, Senator, here, as you know, is ensuring that folks have timely access to information. And we know that there are many centers where information is being provided that is erroneous, that is false, that is not based on medically accurate information. And because of that, the information that women are receiving is untimely and is leading to delays that could result in significant health issues. And I'd like to turn it over to one of our sponsors to talk about the study that they did that demonstrated exactly that.
Thank you. Yes, we did a year-long study where we visited in person over 25% of the crisis pregnancy centers in California. We conducted telephone interviews with others. And what we found is in 91% of those situations, women were told misinformation about medical health. They were told erroneously that abortion is linked to breast cancer. They were told erroneously that it could lead to suicide and infertility and mental health problems resulting. They were told that contraception doesn't work. They were told that condoms have holes. To your other question regarding about other centers, what we have found is that if you are enrolled in Family Pact and Medi-Cal provisions, you are already required to give out comprehensive health information about your options. And this is actually a bill that just raises the standard of care for all women seeking information about a pregnancy, regardless of where they find themselves.
And why then would not these provisions, should they not be extended to those other facilities? Maybe they're doing a good job, but this certainly would make them do an equally good job. And I would argue, most assuredly, everything should be pari passu, equal. It makes no sense to have a bifurcated notification system or requirements.
Right. Those facilities are already required to do this, and actually a slightly higher standard where they are required to hand it out to their patients. This is a posting notice, not handing it over. So it is actually just making sure that there is standardized care across all centers. It is not singling out anyone. It is raising the standard of care.
And are they required to give information about other than abortion as an option?
Yes, they are required to provide information about access to contraception, prenatal care, and adoption.
And as to the health of the now mother-to-be, are they informed of some of the consequences that can ensue from an abortion?
Yes, I believe all these centers do what is called full options counseling, and so they are aware.
Yeah, okay. Why, I find a compelling argument voiced here a while ago of compelling individuals against their religious beliefs. That seems to be a fundamental American right. Why would we want to compromise that right?
I don't believe that we are trying to trample on anybody's rights, but as a citizen of the state of California, I have the right as a woman when I walk into a clinic to be sure that there is a basic standard of care. And and a lot of times in the advertisement, it's not clear that this particular clinic will not provide the complete list of services that a clinic that receives Medi-Cal reimbursements is required to provide. So it is just to bring that standard level of care to all people that enter the facility, all women.
Do you not, though, see the kind of the hypocrisy of singling out faith-based organizations? What is the justification? Why would you say faith-based have to attain a level that someone else doesn't really?
Let's be clear. There's nothing in this legislation that refers to faith-based organizations. We're talking about any centers that are purporting to provide certain types of health options. And we're saying, again, for unlicensed facilities, it's a simple 2-line notice where you say the facility is unlicensed and there are no licensed medical providers on staff. And for licensed facilities, for which we would hope there's a higher standard, it's a simple notice that says merely, free or low-cost public programs are available for comprehensive family planning services, prenatal care, and abortion services. That is it. We're not targeting faith-based organizations. To the contrary, this would apply to all of these centers.
Well, I have such a respect for you, Assemblyman, but I certainly don't read it the same way. Now, in other clinics, are they required to have the postings that are required by this 8.5 inches by 11 inches and no less than 22 type? Is that in every abortion facility that offers this abortion? Is that required?
It's my understanding, as my fellow testifier just said, that they are required to a higher level of standard. They're required to actually hand that to each customer, client that comes in, patient. Yes, they're required. Other clinics are actually to hand it to each patient, whereas this is just a notification posted. So there is actually a higher standard of care for other clinics. We're just asking to raise the level of care of all clinics to be a basic standard level of information provided to all patients. Okay,
so everybody gets the handout. I get that. But this posted implies on a wall or something. Are other facilities required conspicuously in the entrance facility and at least one additional area? Are they required to have the similar equal postings?
I believe that FPAC clinics and Medi-Cal reimbursement clinics are required to post information about their services, yes.
And that would be under state regulation, I gather?
I assume.
Okay.
And I also want to be clear, Senator, that you're either required to post it up in, say, a waiting room or provide a piece of paper or post something on a website. There's not a requirement in the legislation that all of that needs to be done. So it can be done in a number of ways, and a number of those ways are very unobtrusive.
Okay. If a minor comes to such a clinic, then the minor, under the terms of this, would have to be informed of all of the things here, whether they be a minor or over a minor age 18 and older. Is that correct?
There's no distinction.
And are minors who come to other clinics, other than the ones subjecting the terms of this bill, are the parents of those minors to be informed of the consequences and the opportunities for their child? Are they informed?
Under state law and under the California Constitution, minors are allowed confidential access to reproductive health services. And I think, as you know, Senator, we also have a constitutional support for the fact that minors make these decisions without parental involvement. Of course, we always hope that when when our teens are making decisions like this, that they do involve a parent. In about 60% of those cases, that is absolutely true. But for teens who cannot talk to their parents, this is a means of being able to access that care. And I can tell you, as a minor who sought abortion care, who did not tell her parents, I very much appreciated that ability to access the care that was right for myself.
Oh, of course. You're saying, though, 40% then do not involve the parent? 40%? Do we have that many irresponsible parents? That's stunning.
Mm-hmm. I appreciate the comment that 40%, and that's all of our responsibility as parents. I'm the parent to a young daughter myself who turns 1 on Saturday, but that's not really, this bill does not affect that conversation or that portion of what is already in state law. This doesn't change that portion of state law.
Well, I must say that I do find this very, very troubling, and it goes back many years with me. I was once told by somebody that was operating such a facility that we know best, not the parents. We know best. I've never forgotten that. To me, the blood bond is so very important. And I know probably better than almost anyone in this room from my years heading the Board of Prison Terms of California that there are a lot of bad parents out there. But I do find this just a little bit troubling. The 40% thing is indeed disturbing.
And I would certainly hope that parents would be involved in the decision, but as a woman, and I believe that women know best, so neither clinic, whether it is a crisis center or a traditional clinic, knows best. As a woman, I believe that I should be provided the opportunity to have all the information to make my decision, what's best for me and my family. So as I do agree with you that it's unfortunate that 40% of children do not feel that they have the parental guidance or assistance to help make that decision, that does not change the fact that as a woman, I have to do what's best for me and my family.
And last question, if I may, Mr. Chairman. Do you anticipate any legal challenges? I know there's been some case law that would sort of go to the heart of this particular bill. Are there provisions in here that you have put in to bulletproof it from that potentiality of constitutional challenges?
As you can imagine, we do understand from some of our good opponents that they likely would bring a constitutional challenge. These are issues that have been litigated before, and we spent a lot of time, and I want to thank our Attorney General, Kamala Harris, and her staff for spending a lot of time to ensure that the provisions that we're talking about are constitutional. The Supreme Court recently declined to pass over a judgment that a similar law with similar provisions to what we're talking about on the East Coast would be held constitutional, and we wanted to make sure that what we're talking about is in furtherance of the Constitution, and part at the end of the day, we're all here to ensure that a woman's constitutional right to choose is one that is protected.
Thank you, Assemblymember Chu, and your other testifiers here for your courtesy and your response.
Thank you, Senator.
Mr. Chairman.
Thank you, Senator. I believe Senator Wolk, you had a comment, or, well, Senator Roth, I'm sorry. Senator Roth, comment, question?
Thank you, Mr. Chair. Well, I certainly believe that a woman has a right to choose, including the right to choose to follow her religious beliefs. I'm looking at this. I guess this question goes to the opponents. This appears to simply be a notice bill to me. You're required to put a notice on the wall. Is there anything inaccurate in the language that's being proposed for the notices themselves?
There's no inaccuracy. We are just opposed to the word abortion being in the notice because we are organized as abortion alternative.
Right. So with respect to the notices themselves, in particular the notice that's required to be posted by the license-covered facility, would there be any, it doesn't appear to be any impediment to you posting your own notice next to that notice containing whatever information you want to put in the notice with respect to the services that you provide, the beliefs that you hold dear, or any other subject, correct?
I believe that is correct.
So one mentioned a test program, and I believe it was you, that you had a test program with respect to these notices. Did I hear that correctly?
Actually, that was my group. Ms. Wittig was aware of the findings, but that was my group that implemented the test.
So when you, and I guess as part of the test, you posted the notice?
No, sir. We called the number to ask for an abortion referral. And we were directed to Planned Parenthood. We asked about low and no cost abortion services, and we were told to call Planned Parenthood for that information.
Being visiting a lot of places, particularly government offices, where there are a lot of notices posted on the walls and other places. I just wonder how many times people read those things anyway. So I was going to ask if the notice being posted drove anybody away from your facilities, and I guess that would be an interesting question later on.
Right, later on. We have not, of course, posted it yet.
Okay. Thank you, Mr. Chair.
Thank you. Senator Wilk, you had a comment, question?
Just a very brief comment, and then I'd be glad to move the item. I want to thank you for bringing the bill forward. I appreciate that. I'm a strong supporter of good quality health services for women who are often in very stressful situations. And I know from having served on the Board of Supervisors and being the healthcare liaison on the Board of Supervisors that, frankly, not all families resemble the ideal any longer, not that they ever did. Two loving, caring parents, and I wish that were the case, frankly. There might be less business for the Board of Corrections, prisons that you served on. So I think it's important that clinics provide very important services, not necessarily better than what the ideal that we all like to see, but they're important services, and they may be the only services that young women in need of health services can access, and they need to be able to do that. So with that, I would be very glad to move the item, Mr. Chair. Move that support.
Thank you. We have a motion by Senator Wolk. I'm just going to make just a few comments. Again, I'd like to thank the authors for bringing the issue forward. I guess the concern that I would have, and it's not going to be a question, is just on the unlicensed entities. So when we look at consumers, females that go to any kind of facility, I believe that whatever facility they go to, they should have accurate information, but more importantly, no misleading information. So the concern that I have for the unlicensed facilities is, where does the consumer go if, in their opinion, they feel that they're given inappropriate or misinformation, and who do they go to complain if they feel that that information is incorrect? So, I mean, I think this is the first step. I'd like to see, obviously, tougher restrictions with regard to unlicensed facilities that meet minimal standards on whether it's both sides, however you feel, but I think that the information should be accurate to the public. So I will be supporting the issue and the measure. So with that, would you like to close, members?
I just want to thank the committee and members of the public for engaging in this important discussion. At the heart, this bill is about ensuring transparency and that women receive all the facts as they're making a critical decision for themselves and their family. With that, respectfully ask for your aye vote.
Would you like to make any comments, Assembly Member?
I just want to. I thank everyone for their questions, and I too urge an aye vote. Thank you.
Thank you. We have a motion by Senator Wolk. Item number 11, AB 775, do pass. Call the members, please.
Hernandez?
Aye.
Hernandez, aye. Nguyen? No. Nguyen, no. Hall? Mitchell? Monning? Nielsen? No. Nielsen, no. Pan?
Aye.
Pan, aye. Roth? Roth, aye. Wolk?
Aye.
Wolk, aye.
Currently, it's 4-2. We have some absent members. We're going to place that bill on call. I want to thank you.
Thank you, Senators.
Thought I saw Assemblymember Lowe, but I guess he's gone. Sergeants, can we call some members, please?
Roger was here a while ago. It disappeared.
So, seeing no members, let's go back through the list until we see some members. Let's start off with the consent calendar. Can I ask the public if we can please allow us to continue the work? So we're going to do consent calendar again. Item number 1, 3, 7, 13, and 16. If you can call the absent members, please.
Nguyen? Nguyen, aye. Hall? Mitchell? Roth? Roth, aye. 7.
Currently at 7. We're got to have some members still absent. We're going to place that bill on call.